Hi, and welcome everyone. I'll just give you a minute to come in from the waiting room. Thank you for joining us today. All right, and we will get started. I will turn off our screen share, and here we go. Um, so thank you for joining our monthly Hunger, Nutrition, and Health Action Collaborative webinar. I'm Diane Kolak with the CDC Foundation. The Zoom chat is open. Feel free to introduce yourself and your organization. During the panel discussion, we will close the Zoom chat, but we'll reopen it during the Q&A. Please be nice to each other. Please don't post any political commentary, and please don't try to sell any products. At any time during the webinar, you can submit questions for our panel using the Q&A feature at the bottom of the Zoom screen. And just so you know, we will email you a recording of today's session, which you can view on our website at impacthunger.org. So we'd like to start our webinars with a poll. I'm going to launch that in a second. Just let us know what type of organization you represent. There we go. And we like to leave the poll open for 20 or so seconds. Thanks, everyone. All right, I am going to end the poll now, and I will share the results with you. It looks like we have a nice group of folks from CBOs or neighborhood-based nonprofits, a handful of people from national nonprofits. We have some folks from the private sector and foundations and philanthropy as well. A good portion of folks from academia or universities. And we have some folks from health systems or payers, as well as local, state, federal government agencies. And then we have a couple of people who don't fall into any of those categories. So we welcome all of you. We're glad to have you here for this important conversation. So food security is both a health issue and a community systems issue. Today's conversation will explore how states and local partners can collect stronger food security data, translate those data into actionable local insights, and put evidence to work, from program design and cross-sector partnerships to fundraising and community storytelling. We will also hear about practical support that may help you overcome the cost barrier to collecting data about food security and hunger in your community. So when we talk about food security data collection at the population level, we usually mean surveys. There's one particular survey tool we'll be discussing a lot today, and that's called the BRFSS, or BRFSS. That acronym stands for the Behavioral Risk Factor Surveillance System. In plain terms, it is a state-based health survey conducted with CDC support. BRFSS gathers information from adults about health behaviors, conditions, and preventative care. And states can add questions on priority issues, including food security. The result is population level data that can help public health and community partners better understand the needs and plan for action. So today we'll be exploring how using BRFSS to measure food security can give states and their partners stronger shared evidence base for targeting resources, building partnerships, and improving health. I'm delighted to be joined by 4 leaders whose work spans research, policy, and implementation. Together, they bring perspectives from the national and state levels on what it takes to address the gaps in food security data collection and better understand how we can improve food access for people in communities across all 50 states. I'm going to introduce our 4 guests now. The first is Shelly Ver Ploeg. Shelly is a senior fellow at the National Center for Food and Agriculture Policy and recently retired from USDA's Economic Research Service, where she served as chief of the Food Assistance Branch. In that role, she directed research and data priorities to support USDA efforts to improve access to healthy food and evaluate major federal food and nutrition programs. Shelly's work is focused on access to healthy, affordable food, participation in food assistance programs, diet and health outcomes, and poverty measurement. Shelly holds an MS and PhD in policy analysis and management from Cornell University and a BA in economics from Central College. Thanks for joining us, Shelly. Did I miss anything?
That's great. It's nice to meet everyone, and thank you for having me.
Thank you. And our next guest is Poonam Gupta. She is a senior research associate at the Urban Institute's Health, Income, and Benefits Policy Division, where she studies food security, food access, and access to and adequacy of federal nutrition programs. Poonam co-leads Urban Food Security Data Collaborative, advancing the collection, availability, and use of food security data. Based in Washington, D.C., the Urban Institute is a nonprofit research organization that produces data and evidence to inform decisions by policymakers, practitioners, funders, and community leaders. Poonam holds a Master of Science in Public Health with concentration in International Health from Johns Hopkins School of Public Health. Welcome, Poonam. Did I miss anything?
Thanks, all good. Great to be here.
Great. And next we have Allan Nkwata. Allan is a colleague of mine at the CDC Foundation. He is a data analyst supporting Places, a data collaboration among CDC, the Robert Wood Johnson Foundation, and the CDC Foundation that provides local health and health-related estimates for counties, places, census tracts, and zip code tabulation areas. And I think he's going to explain what zip code tabulation areas are as he tells us about his project. Before joining Places, Allan spent 9 years as an epidemiologist with the CDC's National Healthcare Safety Network, where he managed and assessed hospital-reported data and conducted routine analyses. He brings deep experience in applied epidemiology and data quality work to his work. Allan earned both an MPH and a PhD in epidemiology from the University of Georgia. So welcome, Allan.
Thank you. Thanks. Thank you for having me here.
Thank you. And last but not least, we have Sabrina Tadele. She is the Deputy Chief of Strategic Initiatives at the Capital Area Food Bank near Washington, D.C., where she leads enterprise strategic planning, innovation, and cross-functional efforts that turn strategy into action. Sabrina advances initiatives focused on long-term economic mobility for clients, develops partnerships that expand impact, and she leads the food bank's flagship research and thought leadership work, including its annual hunger report. Sabrina brings experience in food security, poverty, sustainable agriculture, and clean water access from work and volunteer roles in the United States and internationally. She holds degrees from the University of North Carolina at Chapel Hill and George Mason University. Welcome, Sabrina.
Thank you. Excited to be here.
Great. So with that fantastic panel, I want to let you know we're going to close the chat for just a few minutes while we have our conversation together. You can submit questions through the Q&A, and we're going to get started with Shelly. Shelly, we're so happy to have you here for this important conversation. For those who are new to this topic of measurement and data collection, and maybe new to the BRFSS survey, I'd like you to help us connect the dots. So why is it important for states to measure food security through a public health surveillance system such as BRFSS, rather than relying only on program utilization, food distribution, or other national data?
Sure, thank you, Diane. The U.S. has been measuring food security, which means access to enough food for a healthy and active life, for about 30 years now. The measure, which is based on a set of survey questions, has been validated through extensive research and is a well-regarded measure of economic well-being. Food security is also correlated with a wide range of health outcomes for young children all the way through old age. So much so that the Department of Health and Human Services uses food security as one of its metrics in the Healthy People 2030 campaign. We also know from research that USDA food assistance programs, for example, the SNAP program or the school meals and school lunch program, impact food security. And of course, the national level, we invest quite a bit of money in those programs to help people meet their food needs. So that's a general reason why we would measure food security. More specifically, states might be interested because they can track their own populations and target resources based on that. Now, that's a little bit, we've come to a situation where we don't have great data at the state level. The USDA used to fund the food security supplement in the current population survey, but that was discontinued last year. That survey gave states 3-year estimates of food security. So they averaged the food security estimates over 3 years. The survey's large, but it's not large enough to support a single-year estimate. What I'm very excited about is the potential of the Behavioral Risk Factor Surveillance System, or BRFSS, as you so nicely introduced, as a potential resource for states to add the 6-item food security scale, which is based on 6 questions, and it will give you a prevalence estimate of low food security and very low food security in the population. As you said, BRFSS is a well-established survey that has CDC funding. It is a large survey. Over 400,000 adults are surveyed each year. That is large enough to support state-level estimates of prevalence of food security and potentially some sub-state and subpopulation estimates. So we're really excited about as this is a potential a vehicle for asking food security questions. And then one might be tempted to just look at utilization of food assistance programs, for example, SNAP caseloads, or utilization of food bank data as a measure of food security, but that would be incomplete. And that's for 2 main reasons. First, these programs help people achieve food security. We know from research that some SNAP participants, because they participate in SNAP, are food secure. A second reason is that not everyone has access to those programs. Some people might be ineligible. Some people might not have access to the programs or to the private food assistance. And so you really need a general population based metric to understand food security. So those are my 2 points there.
Thank you. It's great to understand what's different about BRFSS and the value that would have over other data sources that are collected in different ways. You mentioned that BRFSS can include the food security module questions. What are some of the most important early decisions that a state would want to think about since you're an expert in this type of data collection? Things such as selecting questions, building internal support, planning analysis, and maybe engaging non-traditional partners. Is there anything that folks should keep in mind if they're thinking about adding the food security module?
Yeah, I mean, I think the BRFSS has a capability for each state to add questions to the core survey that the CDC funds, plus some other questions that states can select that are also funded through CDC. The state-added questions are at the expense of the state, but because the survey's already been conducted, states are piggybacking on an existing survey, which means the cost can be quite low compared to what it would cost for them to do their own standalone survey. So the first thing I would ask states to do is, if you're interested in obtaining measures of food security, to reach out to your state BRFSS coordinator. There's a website on the CDC website that has a coordinator's email and contact information for each state. Those coordinators, I haven't talked to all of them, I've talked to several, are extremely helpful and want to do what they can to help community organizations in their state get better information on data that's critical to understanding well-being. But the survey is, the They have competing interests, so it's not necessarily that these questions would be added, but it's you can make a good case, and I'll talk about a little bit of how you can make a good case for that. So the first step is to talk to your state BRFSS coordinator. Right now, in most states, they are planning their 2027 surveys. So I would do that immediately. And then start building a coalition of people who might be interested in having the data and that can broaden the use of the data once it's available. I would go first to state agencies, the Department of Health, perhaps the Department of Social Services, or whoever administers the food assistance programs. One might even want to reach out to the Department of Agriculture. They may be interested in, since it's related to food, they may be interested in collection also. I would then go to community organizations. You'll be hearing from some folks from that soon. And then, think of non-traditional, perhaps partners. One might think of rural or small town areas, which, would be may not get estimates in their area, but this BRFSS is large enough to provide estimates potentially for rural areas versus non-rural areas in a state, or for groups of counties that may not have been in the ballgame before. So that's how I would start.
Great, thanks. I'll just remind everybody, we will send out a recording, but feel free to take your own notes because there are some action items you might want to take action on sooner than the recording going out. We just heard why measurement belongs in public health surveillance and what it takes to get started. Now we're going to turn to a practical question that often determines whether interest becomes action, and that's resources. And resources can be funding. It can also be peer support and learning communities. And Poonam is going to talk with us a little bit about her work at the Urban Institute. So cost can be a real barrier for states that want to add extra questions to the BRFSS. Poonam, can you describe the Urban Institute's upcoming funding opportunity, who's it intended to support, what it helps address, and what people should do if they think their state might be a good candidate for working with the Food Security Coalition and getting involved?
Absolutely. Thanks, Diane. Yes, cost can definitely be a barrier. The cost depends on the state for adding 6 items to the BRFSS. We've seen them range from as low as $15,000 to as high as $60,000 for 6 items. So we're really excited to share that the Food Security Data Collaborative, hosted by the Urban Institute, has a new funding opportunity available to assist state efforts to add the 6 items to the upcoming BRFSS in 2027. So I can give you a little bit more information on that opportunity. We are currently accepting applications from nonprofit stakeholders. The max amount would be $35,000 to cover the cost of 6 items. More on that in a minute. But applicants must be nonprofits, and then the idea would be that they can transfer the funds to the state. Unfortunately, we're not able to grant directly to any state agencies. The $35,000 won't, of course, cover the total costs in every state, but we still encourage you to apply, and we just ask that you maybe outline a plan for fundraising the remaining funds. And we appreciate any sort of commitment that applicants or partners can provide to sharing the costs, as we're really trying to stretch our funding as much as possible over multiple geographic areas, or maybe even subsequent years, like if we wanted to continue funding it next year. So we are accepting applications on a rolling basis until August 31st. The awards would be administered first come, first served basis, again, just because the funding is limited. So we do encourage you to apply as soon as possible. It's a pretty short application. Once we review it, we can issue a conditional sort of letter of funding. This basically just says that pending a successful confirmation from your state that yes, your state BRFSS will include the 6 items, we could then award the funds. So in terms of what you could be doing now, like Shelly mentioned, definitely talk to your state BRFSS coordinator if you haven't already. We've actually seen that in some states, the 2027 BRFSS is already full. So, the sooner the better in terms of having those conversations. And while we don't necessarily require this, it would be helpful to just get one application per state, just because we can only ultimately make one award in each state. So any sort of coordination or coalition building that can happen on the back end prior to submission would be beneficial.
Thank you. I see we got some thumbs up from folks. And we'll share a link to the funding opportunity and more information next week when we send out information from this webinar. So you'll get that then. So beyond just funding, what partnerships have the greatest potential to make a state's food security data effort durable? Because you want to make sure you're collecting a good sample if you're putting the work forward for this. Do you have any suggestions about particular partnerships that would be particularly useful for this?
Yeah, absolutely. Yes, we definitely see the BRFSS as a path for durability when it comes to food security data collection. Um, I'll also just flag that we don't actually see adding these food security questions to the BRFSS as necessarily like a temporary or a stopgap measure in the absence of the federal collection in the Census Population Survey. Even with the successful reinstatement of the full food security supplement, which we all hope for, the CPS at the end of the day still can't produce the level of state or even sub-state or subgroup estimates that the BRFSS can. So there's a very clear value add to adding these questions to the BRFSS, and we see these efforts as complementary. So to keep it funded for years to come, there's definitely a need, as you mentioned, for consensus building and getting more than one sort of key stakeholder involved. There's definitely a variety of sectors, I think, that would really have a vested interest in this data. That could be part of the partnership building. There's, of course, the more obvious entities, such as direct service organizations involved in food assistance, even state agencies that administer food-related programs like SNAP and WIC. But zooming out a little bit, health systems, for example, are another big player. Given all the literature connecting food insecurity and health outcomes, also connecting SNAP and reduced health expenditures, there's a clear value proposition that can be made to this broader health system. So healthcare providers, insurance companies, et cetera, can all be involved. There's also big interest from philanthropic organizations. We've found that they have a growing interest in just more broadly supporting state level data collection, especially after all these shifts that we've been seeing in the federal data landscape and just how fragile that ecosystem can be. There's growing interest there. And then, of course, there's the private sector. I think a value proposition could be made there too, like food retailers, food delivery platforms, for example, could all benefit from understanding trends in food hardship over time, as that directly impacts their business. So there's definitely a lot of stakeholders that could and potentially would benefit from being part of some sort of food security coalition. And so we would encourage everyone to get involved.
Thank you. That was a great list of partners and the types of partners that you could consider bringing in, and not necessarily the ones that come to mind immediately. Just thinking about food retailers, and absolutely they would have a vested interest in understanding food hardship. Thank you for that. And so now we're going to shift over to understanding how this BRFSS data is used and communicated through one particular project called Places. And we have Allan, who is a data analyst with us. And I'm hoping that Allan can walk us through how the BRFSS data inputs, the answers to the questions, become locally useful in the small area estimates that the Places project creates and shares. So we have Allan.
Yes. Thank you.
Okay.
So thanks, Diane, again for having me on the panel. First, let me give you a high-level background on the PLACES project. So PLACES stands for Population Level Analysis and Community Estimates. PLACES is a collaboration between the CDC, Robert Wood Johnson Foundation, and the CDC Foundation. So what PLACES does, it provides model-based estimates for 40 measures amongst all counties and most incorporated and census designated areas, census tracts, and zip code tabulation areas across the United States. And we'll speak more about those in a moment. However, PLACES was launched in 2015 as the 500 Cities Project. And at that time, it provided city and census tract estimates for 27 chronic disease and health-related measures across the largest 500 US cities, then using 2010 census data. In 2020, PLACES became rebranded to PLACES from the 500 Cities Project to PLACES, greatly expanding geographic coverage to provide population level health estimates across those 4 areas: counties, places, census tracts, and ZCTAs. So in BRFSS, on the other hand, states collect individual level health surveys, responses from adults 18 years and older, about chronic conditions, health behaviors, preventive services, and in states using relevant optional modules. As they'll also collect additional data such as health-related social needs, and this is where the food insecurity aspect comes in for PLACES and BRFSS. But back to your question, Diane, the simplest way to think about the relationship between PLACES and BRFSS is this. BRFSS collects the survey data and PLACES models those data to produce reliable estimates for much smaller geographic areas. And I'll explain this a little further. BRFSS is designed primarily to provide reliable estimates at state and certain sub-state levels. I hope many people here know it. However, an individual census tract, a zip code tabulation area, or a ZCTA, or a small community often doesn't have enough respondents into the BRFSS survey to be able to calculate stable, direct, reliable estimates. So that's a huge limitation right there. And this is where PLACES come in to address this limitation. So in PLACES, we use the small area estimation methodology. And what we are talking about here refers to us in PLACES combining BRFSS survey responses with demographic and population level information from the census population data, as well as the American Community Survey. Then, having brought those 3 data sets together, we use multi-level regression and post-stratification approaches to generate prevalence estimates in smaller geographical areas. And that's how we're really able to translate, from the big state level picture to counties, cities, ZCTAs, and then the smallest being census tracts. So, for instance, in 2025, PLACES generated modeled estimates for 3,144 US counties, including DC. We generated estimates for 20,923 incorporated places and census designated areas. That was in 2025. PLACES generated 83,000 very small neighborhood level areas, and this refers to census tract, and those smaller, designated areas. And we generated data for 32,520 ZCTAs. So this is really the major value that PLACES adds to BRFSS. BRFSS provides the underlying data, and then PLACES translates that data into standardized local area prevalence estimates. Another key point I would want to add is places makes local variation visible. By that, I mean that a state buffer's estimate might tell us, for example, that 35% of adults in a state experienced a diagnosis of depression in 2025. Whereas that is valuable for understanding the state picture regarding depression, it does conceal substantial variation going on within the state. But because places provides modeled estimates at county, place, ZCTA, and census tract levels, this makes it possible for us to identify areas where the estimated prevalence of depression is higher or lower in that particular state. So that's just one example right there of how places fits into this broader discussion. However, I would also want you to note that places health measures generally follow buffers measure definitions. For instance, a places arthritis estimate is based on the relevant buffers survey question. And then the other thing I wanted to point out is that places data are publicly available on the CDC webpage and can be downloaded from the data portal there. There are also interactive maps there and comparison reports for you to compare data between places or counties or ZCTAs. Thank you.
Thanks, Allan. Places is pretty amazing. And this has been going on. How old did you say the project is from when it started as 500 cities?
Since 2015 as 500 cities, then in 2020 it got rebranded to Places.
That's amazing. That's an incredible length of data to have to be able to potentially look at how things have changed over time. And I dropped, so that everyone knows, I dropped the link for the Places website in our chat. I hope you'll go check that out. It's not, as Allan said, it's not just the BRFSS data. It also uses data from the American Community Survey. Yeah, there's just a breadth of really fantastic information, and the data analysts who work on the project take the large data sets and bring it down to a level even census tract, which is just really, really valuable. I'm not sure there are very many other places you can get that kind of information. So, Allan, I want to thank you for bringing the data analysis lens to the conversation. And if people have questions, what is there anything they can do if they have questions about places? Is there a place they can reach out for help?
Sure, thank you. So if anyone has questions, please relay those to the Places mailbox at places@cdc.gov.
Great. Thanks, Allan.
However, Diane, did you want me to deal with how Places really blends in with food security aspects?
I think I'm going to come back to that because we're running a little bit long. But if we don't come back to that question, I will include that information in our notes that we send out.
Okay. We're
getting quite a few questions in the Q&A, so I want to make sure that we have time for that. Thank you. As a reminder, please use the Q&A, throw your questions in there for the panelists. And we're ready for our fourth panelist. As we've heard, local estimates can reveal where needs may be concentrated. Sabrina, let's bring that into the day-to-day reality of a food bank and its partners. From a food bank perspective, what changes when you can pair operational knowledge and client experience with credible local food security data? Can you share an example from your work so that that relationship becomes clearer to us?
Sure. Yeah, absolutely. Well, first, just to share a little bit more about the study that we do, the hunger report, which Diane mentioned earlier. We have a very unusual service area in that it crisscrosses Virginia, the District of Columbia, and Maryland. So a lot of the data that is out there on food insecurity and related issues wasn't useful to us because we needed to slice down to the county level and create a local picture for ourselves. And we decided to do our own study with a large representative sample of our entire service area so that we could understand what the prevalence rates of food insecurity are in the DMV, as we call it, the District, Maryland, and Virginia. And so, as a food bank, obviously, we have very deep insights on the landscape of food insecurity from being on the ground and in relationship with hundreds of food pantries that all source their food from us. But when it comes to important organization level decisions about where to invest limited resources, we really needed credible data on food insecurity to inform those decisions. And so we went down this path of collecting the data ourselves, and we now use that data on food insecurity prevalence rates at the county level to guide our annual meal target setting for each of the counties that we serve, with a commitment to equitable distribution of resources that's proportionate to the level of need across our service area. So, for example, in this fiscal year, we're going to distribute 70 million meals worth of food into the DMV. And this exercise of meal target setting that we did right before the fiscal year started is the first step in a waterfall of decisions that we make every year about exactly where all of that food is going to go in the region. And the data is absolutely critical for that decision making.
Thank you. It's great to hear how you use that data. And so I'm going to blend our next two questions together a little bit for time. But how can a community-based organization use BRFSS data or other food security data to really improve efficiency and impact while avoiding a purely deficit-based story about the community it serves? And that question really comes from the fantastic report that the multimedia report that your organization puts out, and we'll send a link to that for everybody with the notes.
Sure.
But how do you?
Yeah. So I love that question. I really appreciate the importance of framing the communities that we serve in an appropriate light. We are committed to using not only the data, but complements to data to achieve that purpose. So on the data side, we intentionally capture and publish statistics about the demographics and experiences of our clients to help bust myths and misconceptions about who in our region is facing food insecurity. One example of that is a statistic that I love to use about employment rates. Some people who imagine the archetypal food insecure person might imagine someone who's unemployed and living in poverty, but the reality from our data is food secure and food insecure populations are employed at virtually the same rate when you look at those who are in the labor force. So that really helps us characterize our clients as hardworking people who are trying to raise families, not just communities with deficits. And to complement that, I've learned from doing this report for several years that that data is very powerful, but to reach a broad audience with a message, you can't use numbers alone. You have to include photos and visuals and people's stories. And several years ago, we made the decision to incorporate our clients' voices in this project from start to finish. So today we go to a focus group of neighbors who are experiencing food insecurity at the very beginning of the process when we're formulating our research agenda to test what we should even be asking about. Then when we have the data back, we go back to that group and test our narrative framing to ensure that it resonates with their lived experience. And then finally, once we're in production, we invite our clients to share their stories in video interviews, so their literal voices are in the report. And we place those videos intentionally to amplify the points that are being made with data with a person, a real person who's saying, yes, this is happening to me and this is what it's really like. And that can also help, unfold some of the myths or misconceptions that people have about who is food insecure in America or in the DMV.
That's fantastic. And I know that your next report is coming out in September.
Yeah.
We'll invite everybody to sign up for your mailing list so that they can see that. But it sounds like a really innovative and uplifting and empowering way to tell these really important stories and engage your clients in that work. Thank you. So we are just at about where we like to end up for our panel discussions. I'm going to go to each one of our speakers and ask if there is one concrete action you would want members of our audience to take in the next month after this webinar. What's one concrete step that would strengthen food security measurement or help people to better use data that's already available? Any calls to action that you'd like to share? And I'll go in order of the speakers that we had on the panel. So I'll start with you, Shelly.
Sure. I think if they're interested in learning more about food security measurement, they should go to the USDA website, the Economic Research Service. It has a number of resources about measurement and research on it. And if they think it's something their state might want to add to the BRFSS, I suggest they go to their BRFSS coordinators right after this call.
All right. Poonam.
We would encourage anyone that wants to stay in the loop with updates on food security data and measurement. Our newsletters are a great way to learn about that. So sign up for the Food Security Data Collaborative listserv. And if you are interested in applying for the funding opportunity, we encourage you to reach out to us with any questions. Or if another entity in your state has already applied, we can definitely help connect you.
Great. And Allan.
Yes, thanks, Diane. First, I want everyone to know that everyone here to see places as a tool you can use in your work, whatever that is. And secondly, I would want to echo what Shelly said, strengthen state BRFSS participation and coverage so that, including relevant optional modules so that, the survey foundation feeding places and remains robust and useful. So that we want to provide estimates to you, from year to year and, incorporate as many questions as we can add from the BRFSS, survey. So yes.
Fantastic.
Go speak to your state coordinators. Yeah.
Thanks, Allan. And Sabrina.
Yeah, my encouragement would be whether you have direct decision-making authority over this or indirect influence to really thoughtfully select and invest in a strategy to sustainably capture data on food insecurity in your state. And I would think about it on a 5-year time horizon. I hope we don't need this strategy for that long, but I would say to think about this from a multi-year vantage point because standing up complex and expensive measurement solutions that can only last for 1 year is not a good use of resources. You really want to invest in something that's going to create a new data series that your decision makers can rely upon for prevalence and distribution of food insecurity.
Thank you. I love that we did not coordinate this, but everybody was talking about the importance of durability of data collection, that we can't just do this 1 year. We need to have these resources over many years. And as you all pointed out in different ways, it really all comes down to relationships and partnerships. And So thank you. Today's discussion makes clear data are not an endpoint. They're an infrastructure for partnership, a jumping off point for working together, helping states identify needs, helping local organizations target their efforts, and helping funders understand opportunities, helping communities tell more complete stories. Data is really essential to our work. I want to thank our fantastic panel. That I feel like we could have had a 3-hour webinar and had you go into even more detail. We want to save some time for audience questions. I have, I think, a record number of questions in we have 15 questions and plus a few that got submitted during registration. So I'm going to prioritize the questions that came in live since we know those folks are here in the virtual room with us. Let me go to my team and see if they have one particular question queued up.
I saw 3 questions, at least 3, that looked pretty similar on the 2-question hunger vital signs screener versus the 6-item. And I'd love for Shelly's opinion on that. I think we're all like-minded, but I'd love to hear Shelly's thoughts.
Yeah, I saw those questions too. So there is a 2-item hunger vital signs question that has been used mostly in clinical settings. And it's essentially was developed to screen for hunger in those clinical settings. And it might be tempting to use that in a survey like the BRFSS, but it really hasn't been validated in a general population survey. So I really recommend using the 6-item module. For one, you can also get estimates of low and very low food security using that. That's a short answer.
Thanks, Shelly. Let's see. Hopefully that I think that was pretty clear about the advantages and disadvantages of the 2-question versus 6-question survey. Here's a question that we have for Allan on places. Does CDC Places currently have any measures that are based on state added questions, or are the measures only from BRFSS core module and optional modules?
So, see, the measures in places are basically off of the core module and the optional modules mostly. And for the optional modules, we looked at the social determinants of health and equity, that module right there, and that's where our 2 food insecurity questions can arise from. Partly because the states are allowed to ask questions, but they are allowed to also analyze those data depending on their needs. So we, on the places side and on the BRFSS side, mostly will avail those data to the states because those questions were allowed in, but we are not adding those questions into places as yet.
Thanks, Allan. Here's another question that we have. This might be another one for Shelly, or it might be Poonam. This person asks, we are considering the social determinants of health module in our state's BRFSS, which includes 1 question about food security and 1 about SNAP. I think this is the 2 questions that were asked earlier. With competing priorities, is there an argument that the food insecurity module is better than the social determinants module if we can only pick one? So a little bit of a variation on the 2 versus 6 question.
Yeah, I could take a first stab. I would never say that it's better because the social determinants of health module has its own advantages. It asks many questions about other factors related to health. But you can't use the 1 item that is included in the social determinants of health on food security to get estimates of food security. It's just not validated. And it's annoyingly, maybe a little annoyingly different in terms of what the responses are and the wording. So it's very close to 1 question and that's 6 items, but not quite the same. So I know that some states are struggling with what to do. But I think they're coming down to a choice between asking the 6-item food security module or asking the social determinants of health module. And they're just making trade-offs based on what their state priorities are.
Okay. Thanks, Shelly. Let's see. We have a question about thoughts on the future of federal food security data collection. And this is an interesting question. Is there interest in reimagining a survey that pairs both food and nutrition security questions? So not just do you have food, but the quality of your food to better assess health and well-being of everyone. I think, Shelly, we might lean on you for that one. But if any of the other panelists want to weigh in with opinions about that, feel free.
I think this is it's a great question. And actually, I thought I saw someone, Viva Bargava from the University of Georgia. I'll put a plug in for her research that used the NHANES survey and the USDA's National Household Food Acquisition and Purchase Survey data to kind of trade off questions about food security and nutrition security. And unfortunately, the USDA Food App Survey is probably not going to be in the field, but the NHANES is a potential survey where you could, you have extensive measures of diet quality and the food security questions are still being asked. So I would put a plug in for that. And, we're still defining what nutrition security is, but I think there's a lot of great research that could go on using the NHANES.
You. And here's a question for Poonam, since a lot of the work you do is around research in this area. How can we use food security data to influence federal and state policy related to poverty reduction? That's very much in line with the work of the Urban Institute.
Absolutely. That's agreed. That's a really great question. I think what's most top of mind for everyone right now when it comes to trying to understand federal and state policy is, well, on the federal side, is just understanding the impacts of some of the most recent significant changes to the federal safety net, particularly to the SNAP program. And I see that as the biggest value add right now of why it's so important to continue collecting food security data. That's really the most surefire way to be able to track the impact of policy. One great example of that is during the pandemic, federal data collection of food security data was able to show the efficacy of all the federal aid that went out, unemployment benefits, stimulus payments, et cetera. And we saw that food security remained actually stagnant over that period. It didn't go up. And so it just showed the effectiveness of those policies. So I think that's really just, advocating for continuing food security data collection is really the best way to answer some of these tricky policy questions of what impact does this actually have on a household's well-being and hardship.
Thank you. Sabrina, do you want to talk at all about how you might use data to educate policymakers or persuade people to better understand the impact of the work that you're doing?
Yeah, I would echo everything that Poonam said, and I would offer that, especially in our current moment where data on food insecurity has disappeared to some extent, having this data makes you the authoritative source of truth when you go to these policymakers who are seeking to understand what's happening in their communities. So it's an investment that I think pays dividends back. You're going to become an ally and a resource to those decision makers as the source of information on food insecurity. And I'm saying that from experience in the Washington, D.C. area.
That's really important and a really good point to make around this. So we have more questions than we can answer today, which is so exciting. I will capture all of the questions that you've put in the Q&A, and we'll share those with our panelists afterwards. If it's something that we can reasonably get in a short answer on, we'll share that with you by email. But I want to thank everyone who has engaged and asked questions today. Thank you everyone who's engaged in the chat. We like to ask, is there something, some action that you're going to take after this webinar? And if you could put that in the chat, we love to hear that. Is there something you learned today and some way that you might act on that? That's really great for us to know. All right. So you can just put that information in the chat, and we'll look at that afterwards. I want to let you know that we do this webinar every other month. So the next one will be Wednesday, October 21st at the same time. You can save the date and register at impacthunger.org. And I want to, again, thank all of our panelists today, Shelly, Poonam, Allan, and Sabrina. I learned so much about data collection just through our preliminary conversations putting this together, but then it was really amazing to hear all of your perspectives together today. I think you helped make a really compelling story. And for our participants who have stayed here through the entire webinar today, I'll ask you, please fill out the survey that's going to pop up in the browser window when you log off. It's really important for us. We read every single answer, and we take that information and use it to make future webinars better. As an example, we used to do these for 30 minutes. Now we do them for an hour because enough people asked for that. So please do give us your feedback. We really appreciate it. And again, we'll send out a recording with notes and resources next week. And you can stay connected with us through our mailing list or just email us if you need anything or have any questions. All right. Thank you very much, everyone. That is a wrap on our August webinar. Have a great rest of your summer, and I will see all of you soon.